Good evening, everyone, and welcome to the Canadian Concussion Center's webinar series, which is sponsored by LiUNA, the Laborers International Union of North America. My name is Leslie Rotan, and I'm pleased to be moderating this series, which was developed for individuals that have sustained a concussion, as well as we've got healthcare providers attending, as well as family and friends. Just in the event that you haven't been here before, the sessions, we usually have the first half hour or so. We have great expert speakers here to present. And then in the second half, you can get your questions answered. So if you do have any questions, please enter those into the Q&A. You'll see the little icon at the bottom of your screen. So you can enter any questions there. And if you do have any technical difficulties, please enter those into the chat. Christian has very kindly put in a PDF of tonight's talk, so you can find that there. And also, just so that you know, if you go to the Canadian Concussion Center's website, we have all of our previous talks archived as YouTube videos, so you can view those there, and that will include this one as well, which is usually up about a week after the live version. And Christian has just put the link in there to our previous sessions. So just before I move on, we're just going to run a short poll, which we always do, just to get a sense of our audience. I was predicting that we may be a little bit smaller tonight, given the Leafs game, although we will be ending promptly at 7 for those of you that are fans to watch the game. But if you can just fill that out so that we know who is in the audience. So for this evening's session, I'm really pleased to introduce Eden Dales, who is back with us. She's very kindly agreed to come back, and she is a social worker and is going to be talking about when and why to consult a social worker after concussion. So Eden is a registered social worker, registered with the Ontario College of Social Workers and Social Service Workers, and a member of the Ontario Association of Social Workers. Eden received her master's degree in social work from Yeshiva University in New York City and commenced her career supporting clients in the emergency departments during 9/11 in New York City. Eden has almost 20 years of clinical experience in the field of social work with expertise and specialized training in trauma recovery. Eden is the owner and director of Eden Dales Social Work, a community-based social work practice. And Eden also has a counseling practice in North York. She's presented at provincial, national, and international conferences, including the World Congress on Brain Injury in Toronto in 2019, on the topic of female concussions and supporting individuals and families recovering from trauma and concussions. Eden received the 2021 Volunteer of the Year Award from the Brain Injury Society of Toronto for her dedication to the Toronto community of brain injury survivors. So welcome back, Eden, and I will turn it over to you.
Thank you so much. Hi, everybody. I'm so glad to be here. I really love this event, and I'm very passionate about what I do and helping individuals and families coping with post-concussive symptoms that are complex and long-lasting. So thank you for that introduction, and I'm going to start. So I wanted to make sure that I go over the heading, which is when to call a social worker and why to call a social worker after concussion. But I also wanted to make sure I provide a number of resources for you to review on your own. And certainly feel free to reach out to me if you have any questions about it, because it's a lot of information. So today I'm going to go through what social workers do, our unique role in concussion care, why you would consult a social worker. I'm going to provide an overview of concussions through a social work lens. I'm going to go over healing, including self-care, self-compassion, healthy boundaries, and coping skills. I'm going to review what trauma-informed care is in terms of concussion care, and then we'll go through some questions. So about me, you already know. That was a wonderful introduction. Thank you so much. I will move forward. I do want to say that I've done a few podcasts with with Christian, who's on this talk, and with UHN. And there's a lot of great information in those for healing and coping with trauma. So I encourage you to go on to the UHN website for those. So the model that I provide care from is really helping individuals in their day-to-day life and looking at the 4 areas of functioning that we rely on to do all of the things we do in our life. And when individuals experience trauma like concussions, I find that whatever was difficult in their life before, they might have relied on coping skills like exercise or getting enough sleep or having a routine or seeing their friends or having hobbies that they have groups to do that with. And when you are symptomatic and you lose those coping skills, life becomes very challenging. So it's like compounding layers of injury. And I always think of concussions with the multiple symptoms that people have, kind of like if you're walking on, if you break your leg and you're on crutches and you trip and you crack your jaw, your leg doesn't stop hurting. Now you have compounding layers of injury. So that's kind of like concussions with the symptoms alone in concussions, plus whoever you are before the concussion and whatever you dealt with, because everybody's got something they deal with, whether it's mood changes or executive function problems like ADHD, or maybe they have difficulty getting along with their kids or their spouse, or maybe they're alone and aren't able to form relationships as easily. Maybe they have difficulty in school. It could be any number of things. Human beings are fallible. We all have problems. So these problems don't go away after concussion. They're often amplified because we lose our coping skills. So if you think of functioning in terms of 4 areas, physical functioning, my energy, my sleep, my appetite, my ability to get up and move around and do things that I need to do. That's physical. Then there's cognitive functioning, which is executive functioning. So problem solving, organization, time management, motivation, task management, initiation, communication, processing information, outputting of information, making decisions, focusing, memory. Our cognitive skills are very, very important for our daily functioning. Our social and relationship skills, so how we manage arguments, how we manage conflict, how we manage our emotions, and if we're very sensitive and what we do about that when we feel really deeply hurt very easily, if our relationships are affected, how we initiate new relationships, how we maintain relationships, how we deal with feelings of rejection, how we manage our social network. And then there's our mood and our emotional functioning. So how we manage feeling sad or irritable, depressed or anxious, if we have nightmares and not sleeping, if how our personality is, and any problems from concussion or trauma in any of these areas will affect problems in the other areas. So if your primary problems are pain and you're not sleeping, well, that's going to affect your mood. That's going to affect your social functioning and relationships, and that's going to affect your memory. If you have problems in your memory, then you might feel embarrassed to see people, or you might be irritable about it or be sad about it, or you might feel exhausted because of the energy it takes for the cognitive functioning. So keeping in mind these 4 areas of functioning is really important, because it's the invisible injury. We don't always see these problems, but when people tell us what's going on, these are the things they're talking about. Social workers are primarily trained in systems theory. So it's using a model that considers the biological elements of the individual, the psychological elements, the social elements, and the environmental elements. So when we look at clients who are experiencing distress from a concussion, we have to look at how they manage in all of their systems, because we don't live in a bubble. We live in our days in terms of how we function at work, how we function in our family, how we manage in our culture and community and societal rules and laws, how we manage to train for a new career if that's what's needed, how we manage to pay for our housing and stay safe, how our relationships are, what our physical impairments are, how we engage in recreational and leisure activities, and what are our financial stressors. So when we work with individuals, we have to look at how they're functioning in their system. So if you ask somebody how their mood is, and you're attending to do psychotherapy with them, and they say, well, how do you think my mood is? I have nowhere to sleep tonight. Well, that's a very good point. So we need to address those needs, the hierarchy of needs, and we need to help people in functioning in terms of all of their systems. So social workers would look at, okay, what are the problems and what are the possible solutions? You know, can I refer you to somebody for your pain and your symptoms? Can I help you apply for government benefits to deal with the financial stressors or tax credits? Can we educate your family on concussion recovery and help everybody in your home understand what you're going through so they can help support you and get more of what they want from you? Can we help you in your daily living activities? You know, what are you not able to manage? And how can we help put something in place that maybe is government funded that you're not aware of? We're professional resources. How can we help you in your culture and community? Are there opportunities for you to volunteer and have more meaning and purpose in your life if you're not working because you're recovering from your concussion? You know, what kind of vocational assessments can we complete? Or can we refer you to somebody who specializes in vocational assessments after concussions? We really work to address all of the needs in all of the areas of functioning and all of the systems. So like I said, the hierarchy of needs, this is Maslow's hierarchy of needs. And we always believe that we can't deal with your self-esteem and your mood and your relationships if you don't have your basic needs met. So first we have to make sure that you are well supported, and we build that foundation, that house of support. So the layers are there for you to feel safe and then start dealing with the more emotional pieces. But your emotions will not come until you have your basic needs met. So how to find a social worker. So social workers are available in most hospital programs, outpatient programs, going through findasocialworker.ca. There's many community agencies that support individuals far and wide with concussions. This organization, Canadian Concussion Center, Ontario Brain Injury Association, Brain Injury Society of Toronto. There's the ABI network. There's your local Brain Injury Association. There's any number of community agencies that provide resources. They might not provide free counseling, but there's always a way to work through that by engaging in some sort of maybe group educational event or a virtual event. They're always putting on free events for members. There's a trauma resource directory, which is great for providers that specialize in concussion and social workers. Going to your family doctor is always a really good way to start. Most of the family health networks have a social worker associated with them. If you have an insurance claim, speaking to your lawyer, speaking to the adjuster, and certainly any healthcare provider can provide a referral for a social worker. Early intervention in concussion care with social work is key. CAMH has a number of resources on their website that provide the evidence to demonstrate that counseling and psychotherapy with using a social worker's services after concussion and trauma is proven to be effective, because when you are going through something new that you're not familiar with, and it's hard enough for you to understand it, let alone inform and educate your family on what's going on when they can't see it and you look fine, social workers can help educate you and your family and your support network on how to understand the impact of brain injury, concussion, trauma, and what triggers can look like. So set you up for success in terms of your ability to manage unexpected triggers. So you might not know that certain things might be hard for you, but the more education you have, the more empowered you are to feel a sense of control over handling that, right? The startle response, knowing that that's very, very common after trauma, to get easily startled. That's a symptom of post-trauma related stress. Understanding that it's normal to maybe feel less social after a concussion, or maybe hard to find the words to express what's going on with you. We can help alleviate that distress. We can help bring awareness to how trauma can impact individuals and provide immediate practical coping skills Social workers are strengths-based in our model. Any health professional who identifies problems and wants to address things that you're doing that are negative is maybe not the best way to heal. I believe heavily in finding people's inherent strengths, validating their symptoms, validating their concerns, and building on that positive self-talk, because the more that they identify their own strengths, the better they're going to do. So the world tells us what's wrong with us. We really don't need to be reminded of that. I don't think there's any value in that. I think there's tremendous value in helping people recognize how much they've accomplished, how much they've gone through, and they are moving in the right direction, one foot in front of the other, one step at a time. So I love strengths-based approaches. We use mindfulness and structure. I think this is the winning combination to gain control over trauma symptoms. And if we teach people this early on, how to calm your nervous system, your stress response, which I'll get into later, and how to put structure in place so things feel more in control, that I think is really the best way to get through that recovery period. So instead of having hours and hours and hours where maybe you're tearful or ruminating on negative thoughts or worried about the future where there's no end to that, well, that's going to be very depressing. But what I give people is a clear structure, how to manage distress and calm themselves. And if they're going to have, they're going to preserve, half an hour a day to grieve the loss of independence, the loss of identity from pre-concussion, then that is structured, and then that's followed by another activity. And every hour of the day is structured, because the more out of control we feel, the more structure we need. If you think about it, an adolescent who's out of control behaviorally, well, every program is very structured. So the more behavioral, the more structured the program. Any sort of rehabilitation program, rehabilitative judicial system, restorative justice, it's all structured. So the roles are clear of the individuals that work there. There's no blurred lines. The schedule is clear. They don't really have to worry too much about when they're going to do what they're going to do, because that's set out ahead for them. And that helps them gain control and focus on their internal coping resources and know what's coming next. So things aren't open-ended. So I highly recommend structure and mindfulness. And social workers will help you prepare for challenges in the future. So if an individual hasn't yet maintained a job, or if they haven't yet found a partner and they're looking for one, if they have a partner but they haven't yet started a family, these are all major life transitions that can be very stressful post-concussion, because there's changes that are biological, physiological, chemical, emotional, social, that will impact that. So the more we can infuse that support and that strengths-based approach, and they know they're not alone, the more that they feel capable and confident to move forward. So trauma-informed care is something I'm extremely passionate about, and I think it's really important for this community to be aware of. It's much more detailed than this, but these are 4 key concepts of trauma-informed care. And the model was designed to help resist re-traumatization. And I'm sure anyone listening to this can think easily of an experience since their concussion where they felt re-traumatized, they felt marginalized, they felt dismissed, they felt not believed, they felt that they really weren't seen. And this was born out of the child welfare system, along with the ACEs study, Adverse Childhood Events study in California in the 90s. But the idea is that if we train people in this model, we can really help individuals to feel heard and seen and supported, and resist re-traumatizing them by saying things like, well, you look fine, why can't you work? Or it doesn't look like there's anything wrong with you. That's very, very marginalizing, and that is very, it's demoralizing for an individual who's suffering. So the concept of trauma-informed care is to realize that somebody may have experienced trauma and might not be aware of the impact of that trauma. So maybe somebody said, oh yeah, it was just a concussion, but really they don't even know the full impact it has on themselves. They might not have insight to that. So realizing that people might have experienced trauma and we have no idea how that impacted them. Recognizing the signs and symptoms of trauma in clients, families, and staff. responding with empathy, compassion, and knowledge about trauma-informed practices, policies, and procedures, and then resisting re-traumatization of any individual by really believing people when they say they're suffering, and respecting their perspective as their own, and respecting their reality as their own, and not having a judgment or an assumption or an opinion about their experience. So state-dependent functioning is something I really educate a lot on, and I think it's really important that people recognize that trauma happens in the brain stem. That's where trauma kind of lives and is remembered. That's the part of the brain that isn't thoughtful. It's not aware of time or space or who I am. There's no reasoning, there's no rationale. It's just immediate fight, flight, freeze response. And when somebody goes through a trauma or has a concussion or their stress response is activated, the behavior is not thoughtful, it's not planned, and it's reactive. So if somebody reacts poorly after a concussion, which we see, it's lack of emotional regulation or difficulty managing anger or distress. Knowing how to respond to that person is really important, because it can make the difference in how the entire day goes. If we don't recognize state-dependent functioning, and we don't give thought to what brain state is somebody in, then we're going to be expecting them to be reasonable when they're not at all able to move up to their thinking part of their brain. So it's as if a toddler was screaming that they don't want to put their jacket on. Well, we're not going to discuss it and negotiate it. We're going to lift them up, put their jacket on, and take them where they need to go, because in that moment we know better than the toddler. So it's not that people are behaving like children, but it's that they maybe aren't able to reason like an adult in that moment. So this model helps us to understand that, naming and recognizing our emotions is really important for healing. So being able to name our emotions. Anger isn't really a core emotion. It's the socially acceptable emotion that we're faced with. And we easily acknowledge that we get angry, because everybody gets angry. And we are able to say somebody else is angry, but really what's going on beneath the anger? Because anger is usually the result of feeling frustrated, not knowing the answer, grief, feeling overwhelmed, feeling embarrassed, feeling ashamed, feeling rejected, feeling scared, any number of core emotions. But the more we can recognize our emotions and what's really going on, if you're really honest with yourself, that's how we start to heal, because the anger will just intensify the more you kind of reject what's really going on with you. And if we think about this with somebody else, then we're able to say, well, maybe there's something else going on here. Maybe I'm going to be able to ask them about it, but not in this moment. So these are just some really good tools for coping with anger and with distress. And concussions cause people to spend a lot of time in their stress response. So that's what I was talking about, the brain stem. So that's kind of the bottom brain, the downstairs brain. There's lots of reptilian brain, lots of different terms for it. But we know that not much thought happens in the brain stem. So this is why you'll see people doing kind of having extreme reactions to non-extreme triggers, like running for cover if they had been in the army and they hear a tire pop 20 years later. Well, that doesn't make any sense because there's no danger. But at that moment, for that individual, they feel like they're in danger. That's the fight, flight, freeze response. But the idea of working with individuals that are spending a lot of time in their stress response, which leads to negative interactions, which we want to kind of rebalance with more positive interactions, is that we need to teach people how to regulate their stress response. And I really believe that cognitive behavioral therapy and cognitive reframing and psychotherapy is all wonderful, but it can't really happen until we're up in our cortex, in our reasoning part of our brain. So until we can learn to regulate, we can't expect somebody to engage in meaningful psychotherapy. So this is stuff that anyone can do at any time. And these tactics work. So when somebody is dysregulated, and you can tell that because they appear angry or irritated or agitated or enraged or frustrated or maybe shut down, anything that's not reasonable, we know that we need to help them regulate. So regulating means anything repetitive, anything heart rate, getting your heart rate regulated. So going for a walk around the block, anything like drumming or music, hungry, angry, lonely, tired, breathing different air. So as soon as I notice that anyone, well, my children are dysregulated and repeating all these really, really negative comments, I say, yeah, I know, because I'm not going to get into the details of what they're saying, but my job is to get them out of that environment, because we can't calm in the same environment we got distressed in. So right away, we're going to breathe different air. So we go right outside. Doesn't matter what the weather. Yeah, I know you're going to fail school. I know everybody hates you. I know that you want to die. I know. So you don't argue any of that, because that's not in the reasoning part of the brain. You go outside, put cold water on their chest, put cold water on the back of their neck. You give them a drink of water. You say, I'm really hungry. You want a little bite of this? All of a sudden, not everybody hates them. All of a sudden, they might not want to die. They might not feel like they're going to fail school. So you see the world differently when you're able to regulate. There's a lot of different tools in this presentation that are regulating activities, and none of them have to do with challenging negative thoughts, because that can't happen until we are calm. Once we are regulated, then we can relate and say, hey, I'm here. You're not alone. We're going to get through this. Let's just keep doing what we're doing because it's working. And then you can problem solve, but not until you notice that the person has slowed their breathing, has calmed themselves, and is in a much more reasonable state. So state-dependent functioning is really powerful. So how do social workers help? So we identify internal coping resources, because that is what's sustainable. So I should work myself out of a job with everybody I meet, because it's not sustainable that they're going to see me forever. And we really want to highlight what they can do and what they have done on their own. Humans are incredibly resilient, and when they're believed in, they're unstoppable. So we need to believe in people's ability and not see them as problems to fix, not see them as incapable or as dependent. We need to see them as independent. So increase their independence, help them find solutions, help model for them self-compassion, self-care, compassion for others, and help them gain control over those unhelpful thinking patterns. This is one of my favorite tools. So people who are anxious and have difficulty regulating their emotions, when they're able to write down what they're thinking, usually their thoughts can fit into one or all of these categories. These are all unhelpful thinking styles. The more you practice black and white thinking, always or never, the more you will use black and white thinking. The more you practice catastrophizing, the worst case scenario, the more that you're going to think about that. So we are what we do. So the more we can challenge these negative thought cycles and be aware of them and say, well, is this something that I'm assuming, or is this something I know, right? Did the person tell me they hate me, or am I just feeling like that? Well, that would be emotional reasoning. I feel, therefore it's true. So I'm going to challenge myself to say, are these thoughts real, or are they made up narratives that I've held for so long that I think they're true, but is there evidence? So this is the kind of work we do when we use the cognitive behavioral therapy, and anyone can use this tool by just writing down what their thoughts are and saying, does it fit into any of these categories? Because if it does, of course I feel like crap. So social workers wear many, many hats. We are professional resourcers. We apply for government benefits, tax credits. We will tell you about all the things you're entitled to that you might not be aware of. We help advocate to the school, to work. We write letters for accommodations. We write letters for any number of things. I had a client who had a concussion. She was very impulsive and she was on disability, and the check came to her and she went and she bought jewelry that day. And her mother called the store and said, you know, my daughter had a concussion and she's got problems with impulsivity. And they said, well, we don't give refunds. I heard about this and I thought, no. And I wrote a letter and I very clearly stated that, you know, there's been a tremendous amount of funding put into mental health education in our province, and we have a responsibility to as a business owner to respond to what's being requested of you. And this individual has been identified as having a disability. The concussion makes her very impulsive. This shouldn't have happened, and they had the money back that day. So these are the kind of advocacy efforts that we can help with. I can name dozens and dozens of experience of examples like this, that if you're not trained in this advocacy piece, you might not be able to do it quickly and effectively. It's not always effective, but we can educate the individual that we're appealing to and advocate for specifically what's reasonable, and help use those skills to help move barriers for people. We offer solutions, we help problem solve, we teach calming strategies to cope at any point when you're not with us as well. We prepare reports for litigation, helping to identify the challenges resulting from the concussion. We are witness to your journey over the course of your journey to help support you. And we help educate your family, friends, and support network on trauma and on concussions. We are advocates, we are facilitators, we are educators, we are negotiators, we are learners, we are teachers. We provide kind of the whole 360 view of an individual's life. So when I went to social work school and they said, which population do you not want to work with? And I told them, and they said, well, we don't train you to be a social worker for this population. We train you to be a social worker for anyone, any age, any problem. So that's what we do. We work with people in the context of their lives, who they are, what their personality is, what their challenges are, what their strengths are, and what their barriers are, and help to move those. So when somebody's struggling after a concussion and you're wondering if maybe a social worker could help, these are some red flags that a social worker would be an appropriate resource. So when I say self-harm or suicidality, obviously that's something, sorry, I shouldn't say obviously, that is something that needs to be addressed by the emergency department immediately. So if somebody has any thoughts of self-harm or suicidality, or they're very impulsive, you go right to the emergency. A social worker is not your first call there. A social worker is your call. If that has gone on and they've been to the emergency and there is a doctor who's seen them, also a social work referral would be appropriate. If somebody has significant mood changes, you know, you have to kind of peel the onion and look a little bit deeper to see what's really going on, because we want to look for patterns of behavior, because when something is repetitive, then it can continue and it can kind of spiral downward. So if you used to see friends most weekends and now somebody in your life is maybe not seeing friends as much, but they're telling you that they're busy, or somebody was sick, but it's patterned and it's repeated, we have an indication that they might be socially isolated. So that's a good opportunity to engage a social worker. If their stress is increased to the point where they're getting in trouble, or you know, they're coming close to being arrested, or they're having complaints, you know, you have to consider what goes on and how you make people feel. If somebody's calling the school or a business, or somebody's reporting that their behavior was concerning, that would be a good time to call a social worker. Difficulty regulating emotions, relationship challenges, conflict, marital distress. I mean, I see so many individuals with marital problems after concussion because nobody has worked with the family. They've only worked with the individual, but we don't live in isolation. So if you go and you're getting great therapy and you feel great and it's strengths-based, and you come home and your partner hasn't learned anything new and they haven't been educated on how the concussion might present, then you're going to have the same problems. So when people call me and say, will you see my child? I say, sure, just don't bring your child, because I like to infuse change in the environment first. You have to address the whole family, the whole environment, and make sure everybody is aware that concussion can look like sitting in the corner and not wanting to eat or not wanting to see friends. It can look like impulsivity. It can look like really, really fast thoughts that none of them stick. It can look like any number of symptoms that are in the guidelines. So that's a lot of different changes that people might not be aware of. And I think it's really important that we work with the family to help marriages sustain the recovery. Decreased interest in people and activities would be a red flag. Difficulty coping with problems and stressful life events, and challenges with decision-making, focus, school, success. And this is just a CAMH model that I like to provide, that these are risk factors for suicidality. So if you're ever wondering if somebody's at risk, don't hesitate to reach out for support. You can always go to the emergency. You can always call a social worker. We are not crisis workers, but most crisis lines in Ontario are run by social workers, and that's who you will speak to if you're unsure. So don't wait for a crisis to call a social worker. I've had a number of clients where, especially with concussions and mood changes, you know, maybe it's a young person that we know they suffer worse after concussion, adolescence, and they say, you know, I don't want to go to school. And the family says, well, of course you're going to school. And they say, no, I'm really sad. I don't want to go to school. Well, everybody's sad. Of course you're going to school. No, I'm really depressed. What do you have to be depressed about? You know, we came here, like we have this house, we send you to this good school. Like, come on, nobody has time for this. And no, I can't get out of bed. I'm really depressed. Of course you can get out of bed. There's something wrong with you. Your legs work. I'm going to kill myself. Oh my God, there's something wrong with my kid. And they bring them in crisis. And, you know, there was a lot of warning signs along the way, but when people don't feel believed, they have to scream from the rooftops. So it might have been, I don't want to go to school because I'm sad, could have been enough to get support. But this individual had to be very, very sick to be noticed. And then you don't know what is a cry for help or what's organic depression. But either way, that problem, if it had been addressed early on, I could have helped the family learn skills of a different way of interacting with the individual, a different way of supporting them, helping them see why being more compassionate and understanding wouldn't actually hurt them as parents, but it would help their child and help them. So don't wait for a crisis, because concussion symptoms, as we know from the media and sports, and you guys are all here, can be complex, they can be long lasting, and they can be severe. So understanding the impact to prevent problems in the future is really important, and also understanding the impact on the whole family. So sometimes I'll see families and there'll be a sibling and I'll say, so how's he doing? Oh, he's just really quiet. Well, he's who I want to see first, because not everybody expresses their distress by crying or by through anger or by asking for help or saying they're going to hurt themselves. Some people internalize their distress, and we don't know they're suffering if we don't look for it. And we have to really look at everybody in the family and see how they're managing, because we don't know everybody, how they interpret information without a concussion, right? We can't possibly know how somebody's brain functions from birth all the way, their attachment, their environment, their learning, their biological makeup, genetic makeup, chemical balance. We just don't know. So if we provide awareness and education and information, then we get out ahead of helping families understand these are the things to look out for. And this is what's typical developmental. You know, people chalk up rebellion to a lot of behaviors that to me are not rebellion. I mean, there is rebellion, but then there's concerning behaviors that need to be addressed. They're not concerning that they're going to be a forever crisis, but I think we can't just make assumptions that something is just a concussion, or just, oh, they're just a teenager. Oh, they're just, you know, they went through this. It's not a big deal, but these not big deals can escalate to becoming pretty catastrophic. So, you know, concussions are linked to grief and loss of your identity pre-concussion. And we help people to create a new identity and help reframe that grief into, you know, what the future holds, and how can we find new ways to create a positive identity? How can we find new ways that you have meaning and purpose in your life that looks different than the meaning and purpose you had before, but it's not, you did have it, now you don't have it. You did have it, and now we're going to find different ways, considering the symptoms you have, considering what you're going through, that help you create a new sense of yourself that you like. Most people are uneducated about concussions, programs, benefits, and many people spend a lot of money on programs that are selling very quick recovery treatments, and they're not evidence-based, they're not proven to be effective, and they're extremely costly. And that is something that I really have a strong reaction to, because the concussions are only going to cost money, and they could cost you loss of income, they could cost you loss of career path or promotion or career change. They could also lead to you getting the best help and helping you figure out what's next for you. But going to spend money on programs that you don't know if they're recommended by an evidence-based practitioner might not be necessary. So I like people to preserve their funds and help them apply for what's government funded, because there is funding available for different things. Social workers identify practical needs to improve quality of life, assess risk factors, and offer solutions. So cognitive reframing, this is a video, the link is here in the slide. This is a narrative therapy technique that I really like, because it's called a black dog. I had a black dog, and his name was depression. And it helps to understand that we are separate from our problems. So you are not your concussion. You are an individual that has all these internal characteristics and qualities that make you so wonderful. And then you have a concussion. So the problem is secondary to who you are, and avoiding the problem or wishing it away or wanting it to be gone doesn't work, because it's there. So how can we find ways to get to know your problem, your symptoms, get to know their patterns, the who, what, where, when, why, how of your symptoms? When do they come? When are they worse? Keeping a journal, keeping track of what interactions and what environments are triggering for symptoms, getting to know your problems the best of anyone. So you're like, yeah, I know what that is, and I know it passes. I know this is a headache, and I know why I got it, and I know it's going to go away. So you get more control, and you start to see that there are waves, and emotional states are not permanent. And social workers will also help to identify what the pre-concussion challenges were, what coping skills were maybe temporarily lost or not accessible, and how can we replace those with other healthy coping skills. Like I said, compounding injuries and recognizing that these are real and validating that is really important. Helping people understand that the more you do, the more you'll do. So repeating negative thoughts will lead to more, but reframing those and finding alternative thoughts and alternative behaviors will help lead to more of that. Cognitive reframe increases positive interactions with yourself and with others. And so what if you can't afford a social worker? So this is a very real question. Everybody's struggling financially right now. Everything is a fortune, and it's pretty rare that people can afford private counseling. So when somebody comes to me and they're not able to afford a social worker, I will tell them, listen, come to me for 2 sessions. I won't charge you. I will blast you with resources, names, OHIP funded programs, government funded programs. I will give you access to my online library of resources that has tools for concussion, anxiety, depression, stress, ADHD, any number of problems. I post everything online. So you should always ask. You should always reach out, and you should always say, what can you do? Ask for sliding scales, ask about help with tax credits. Social workers can identify, like if somebody comes to me, then I'll really identify, what it is you want to address. Why don't you try these resources on your own and see how that goes? Can your family doctor see you for a little bit of counseling? Looking at risk factors for complex recovery. So are there issues that make you more at risk for a longer and more complex recovery? Well, maybe that would get you into a program that I can recommend. A little bit of information goes a very long way. I have transitioned all of my training that I used to spend a fortune on to just reading books from the library, and I'm learning so much. And I really think that we can be creative in how we build skills. One session can be enough. One warm interaction with somebody who believes you can make a big difference. Communication reduces shame and isolation. So always reach out and see where one person can lead you to another person, can lead you to a program. We are professional resourcers. Social worker can identify specific questions for you to ask your doctor. So if somebody comes to me and they're not able to afford a block of treatment, I'm going to say, okay, what doctors are you seeing? Here's some names to get referrals to. Here's some questions you want to ask, and write down the answers or record the session. In one session, a social worker can prepare many letters that you can give to your work and your school and the government, and you can feel heard. So these are a few of my favorite tools for self-compassion and compassion for others. So I told you before about HALT, hungry, angry, lonely, tired. This is pretty much at the core of all unlikable behavior. If you meet these needs before engaging in a discussion about the behavior, you're going to be so much further ahead. So when we are any or all of these needs, when these needs are real for us, we can't possibly behave nicely. We can't drive a car with no gas. So how can we expect that we're going to be reasonable when we have no resources? So imagine like a silhouette of yourself that's transparent and it's just like empty. We need to get the blood pumping and get the heart rate regulated, have something to eat, reach out to somebody who's supportive, have a drink of water, go for a walk around the block, have a little rest, and then revisit whatever it is you're doing. Because until you meet these needs every few hours, we can't expect ourselves to be on our top game. The Little Miss Anxiety is a tool that I developed. It was a little bit long to post here, but I will add it into the chat. And it just, it's about getting to know your problem. So knowing when they come around, what makes them come around, what is their goal, whether it's depression or anxiety or concussion symptoms. The idea is not to get rid of these problems, because they can help us. They can teach us compassion for ourselves and others. They can help us get the help that we need and learn new skills. They're not going to go away. And sometimes anxiety is important. Sometimes it helps warn us that we're not doing something that aligns with our values, or we're not being treated respectfully, or we're not being heard, or we don't feel safe where we are. So sometimes we need these problems to help us feel safe and in control. But sometimes they come when we really don't want them, and they make us leave places, and they make us avoid people and places we would otherwise like to be. And when that happens, we need to learn to get to know them better and learn that they are not in charge of our lives. They don't hold the remote control to my mood. They are not the ones to decide where I go, who I see, what I do. We are the ones to decide. And the better we know them, the more we can say, oh, yeah, I know you're there. And I know what this is. And I know how this feels. And I know when you're going to leave. So social workers are experts on healthy boundaries. So helping you identify when you are saying yes, when you mean no, how to identify what it is you need and manage your stress and be able to say no without feeling guilty about it, learning to self-advocate, learning to soften towards others and self, tools to manage your stress and get along better with others. And really, boundaries can become affected by concussions, because when we have less tools to rely on for cognitive function or decision making or thoughtful planning, we're more reactive and we're more impulsive. And so boundaries depend on us maintaining a sense of control. Boundaries are where I end and you begin. And where
sorry, Eden, my apologies. We are just running very short on time.
Sorry.
And I just want to make sure we just have a few minutes for a couple of questions that we have.
I'm so sorry.
So that's okay. That's okay. No,
that's
no problem.
I'm good.
Are you sure?
Yeah, I'm so sorry.
No, don't be. Fantastic information, and thank you so much. I think everyone's really enjoying it, but I'm just I'm just conscious of the time, especially
yeah.
this evening with our 7 o'clock end date. So we do have a couple of questions. One of them comes from someone and they're saying, where do you see your role differing from that of an occupational therapist in helping patients post-concussion?
So can you hear me okay?
Yes.
Okay.
Yeah.
So we work alongside occupational therapists very, very well, and we love working alongside occupational therapists. Occupational therapists are, from my many years of experience, are heavily focused on daily functioning and safety. So safety in the home, safety in their environment, and functioning in terms of, like, they'll do a more comprehensive cognitive communication assessment, executive functioning assessment, looking at accommodations for work and home, for physical safety, for health and safety. And we do more of the mental health and psychotherapy piece, where they do more of like, are you safe without care? Are you at risk for forgetting to turn the stove off? Are you at risk for, locking yourself out? Can you manage, what can you manage in your home and at work on your own? And what do you need help with? So much more of the functional, if that makes sense. And we're more to support the psycho-emotional piece of managing your emotions and being able to get to the point where you're going to work. So we really work collaboratively together. I mean, we overlap a little bit, but we do much more of the government benefits and advocacy piece, and they do much more of the functional and attending, like, caregiving needs piece.
Okay, great. Thank you. There's also, I'm just going to comment, I'm going to answer this out loud. Someone is indicating they don't see the resource in the chat. I'm not sure if that's a resource. Were you were going to put something in the chat?
Sorry,
I was thinking
the slides of tonight's talk are in the chat.
Are already in the chat.
The
yes.
resources are all the references for my information.
Okay.
I thought of my library as I was talking, so I will send that. It's a Google Slides public drive that I share. So
Okay.
I will be sure to send that. I can actually send it right now. And then,
okay.
And then
maybe send it to Christian and he can put, if you can do that right now.
I'm going to send him the narrative tool with the wording, and I'm going to also send him the Google Drive public library.
Great. And just in the chat, for all of you, if you scroll to right at the beginning, Christian had posted a PDF copy of tonight's talk, as well as a link to all of our previous presentations. We have a comment from Leslie, who says, thank you for a stellar presentation from both myself and my husband. Heather's asking, would it be possible to have a webinar on teaching coping skills? I don't have a social worker, as I'm on workers' comp, and they don't support social workers. They don't. So you don't work with anyone that's on.
No, I'm shaking my head.
WSIB.
So frustrating. No, that wasn't what I was saying. I was shaking my head, frustrated to hear that. I don't personally work with clients on WSIB. That's not something that I've been asked to do, but I'm very shocked that they don't support social work. Yeah, I mean,
I wasn't aware of that.
I know that
sure on that one.
I don't know that Altum does WSIB. I don't know if they have social work in their clinic, but that's at UHN.
UHN, yeah.
Yes,
I know they have psychologists, but
I mean, I would,
yeah,
be happy to provide education. I mean, like I said, the Brain Injury Association of Toronto, Ontario Brain Injury Association, ABI Network, they put on webinars and educational events all the time. So I would definitely check what's happening, because I know Mood Disorders Association of Toronto has programs. There's a lot of free programs.
There are, and if you get on their mailing,
coping skills, for sure, that's available.
Yeah, and if you get on their mailing list, they will mail you, regularly. Oh, this individual, she or he are in Nova Scotia.
Oh, that's okay. The programs are available. Like the Brain Injury Society of Toronto sees people like in other countries. Anyone can log into their webinars. But my resource library will have a lot of tools in it. And if they, I can look and see what's available and upcoming. And I also post a lot on LinkedIn and Twitter. All the events that I hear of, I repost. So follow me on those for sure.
Okay, great. And Christian has just indicated that he did not yet receive.
I haven't found it yet.
Okay.
Sorry.
Right. Sorry, I'm trying to monitor all the messages.
Okay.
The messages coming in.
Yeah.
Okay, so that was from, does OHIP cover some social workers is a question.
I think through hospital programs, and I think through the family health network programs, like if your family doctor is part of a LIN or a FO or whatever it's called, they usually have a social worker associated. So ask your family doctor to start. And then otherwise in the community health center, there's social workers. Any government agency will have social work or hospital program.
Yeah, for sure. Yeah, it really depends on where
But
you're
not
accessing
unfortunately,
the service. And yeah, unfortunately, I'm not aware of a lot of concussion related, certainly for more severe traumatic brain injury or other types of brain injury. You can more easily access OHIP covered.
But the Ontario Brain Injury did just post something where you can apply for funding if you don't have other funding for services.
Okay.
I'm going to post that as well.
Okay.
I get it done in the next minute and a half.
Okay. Yes,
Yeah.
we have a minute. Mary had asked, how can I see you? How is it funded?
So it's a private practice or funded through motor vehicle insurance. If those are the two ways mostly that we're paid for our services. So if there's a motor vehicle claim, we can submit a claim to a treatment plan to the insurer, or it's private pay.
Yeah, and just in terms of coping skills or in terms of symptoms that you may be having, our webinars that have been running generally are focused on different types of post-concussion symptoms. So with each of those, you will generally get some coping skills depending on the symptoms. So that would be another resource. But I agree, there are also groups that run, for example, the Brain Injury Society of Toronto, OBIA have peer support programs as well. We had someone else ask, did you say that the Little Miss hungry, angry, tired, etc. slide wasn't in the presentation?
I'm sending it right now.
Oh, okay. If so,
you want me to send it to him and he'll
this?
post it, right?
Yes.
Okay.
And
I'm doing
we'll
it right now.
We'll wait a minute to see if
okay, so that one is
gets
sent.
that.
And Christian, I just sent that. And now I'm going to send you the library, and then I'm going to send you the OBIA application that I saw.
Great, thank you very much. And in the interim, I'll just remind everyone that there will be a very short survey that will follow tonight's presentation. So we welcome any feedback, any suggestions that you might have. And we will be back here in 2 weeks. And we actually have an occupational therapist, Leslie Burkett, who is going to be presenting on return to work, vocational rehabilitation, and occupational therapy. And I am just waiting to see if Christian has received.
I have I've nothing in my email yet. I know that there's usually
okay. I'm doing it through my phone again.
Okay. And if you can send all 3 in one email, I can put them together quite quickly. Oh, tool just came in.
Oh, yay. Okay, now I can copy the link. I'm sending you the resource library. Sorry, guys.
Thank you. And we have someone attending who says, thank you. I'm in PEI.
Yay.
Welcome from PEI.
I love Anna Green.
Great to see people from all over the place.
Okay, so that one's sent, and now I'm going to find you the OBIA tool. And Okay, it's called the Compassionate Justice Fund. I'm going to send it to you. I don't know enough about it, but it looked really interesting. And I believe the deadline is the end of this month. So it's aims to support equitable access to rehabilitation and support services for those with TBI from underserviced communities to optimize quality of life. A formal diagnosis is not required. Lives in Ontario, 16 and over, sustained a TBI or concussion through any number of ways to provide financial support and resources for individuals with brain injuries, specifically marginalized and vulnerable communities. Psychotherapy, physiotherapy, case management, social work are some of the services offered. So it's
Yeah, it is an application based.
You know about that one?
I had recently heard about it. Yeah.
So I don't know enough about it, but it's certainly worth applying for.
Yeah. That's great. Well, thank you so much. Thank you to everyone that attended tonight. Thank you so much, Eden, for coming back. Great presentation. Really enjoyed it. And yeah, hopefully that has given people enough time to get that information from the chat.
Well, my email was there and I'm sure they can reach out if they need it.
Okay. So hope everyone has a good evening and go Leafs go.
Go Leafs go. Thank you.
Okay,
Bye,
take
guys.
care. Bye-bye.
Take care. Bye.
Bye.